I'm Abadi, your news anchor for Pharmacology News today, broadcasting live from the newsroom to bring you the most recent medical news. And today, our brave citizens and frontliners perform another critical rescue when Afif, a 20-year-old student, developed a severe nut allergy at a local university, resulting in anaphylaxis that raises the concern of many. And reporting from the location is Pharmacology News own reporter, Mr. Azwan.
Hello Malaysia, you are with me at the location of the accident where a young boy having an allergic reaction and was saved by our medical team. So we are going to interview the medical team for more information. Good evening, ma'am. Can you explain to us what actually happened to the patient?
So the symptoms of an allergic reaction is runny nose, sneezing, pain or tenderness around your cheeks, eyes and forehead, coughing, wheezing or breathlessness, itchy skin and diarrhea, and then there's maybe swollen eyes, lip or mouth. And then if you're with someone having an allergic reaction, you must immediately call 999 or your local medical emergency number. Second, you need to ask the person if they're carrying any epinephrine auto-injector. And then if the person needs to use it, you can ask whether you should have to inject the medication to them. Then you need to loosen tight clothing and cover the person with a blanket. And don't give the person anything to think.
Okay, ma'am. Next question. Can you tell us what was the action taken to save the patient?
What action did we take? We immediately give him epinephrine. We give him epinephrine instead of antihistamine because epinephrine stops the symptom of a reaction that can be life-threatening. But antihistamine just can help with mild reaction, not this severe reaction. If we give him antihistamine, the delay of giving epinephrine makes it harder to treat. So we give him epinephrine as I can see that he is having serious allergic reaction as trouble breathing and speaking, and he seems to feeling weak and passing out. So it's best for us to use epinephrine.
Thank you so much for that, Mr. Azwan. In our set today, we have Dr. Safa and Ms. Ifa, both of whom have medical backgrounds. And now I'll hand over the set to our reporter, Ms. Nawal, who will interview Dr. Safa and Ms. Ifa to provide us with more information on Mr. Afif's condition.
Thank you, Ms. Afi. So here I am with Dr. Safa. Dr. Safa, yes, I am. So based on situation, we would like to ask you about what is the drugs that was used for the patient and how can it help the allergic patients?
Oh, okay. So basically, based on the situation, the drug used is epinephrine. So epinephrine injection helps to treat type 1 allergic reaction that is caused by maybe because of the bites or stings of animals, and it can also caused by the food such as nuts. So before we go deeper about the epinephrine drugs, I will explain the brief things about what is epinephrine. So actually, epinephrine is a neurotransmitter or a hormone that can be released by the adrenal gland. Epinephrine can also act as epinephrine drug. So epinephrine drug and also epinephrine can act on alpha and also beta receptor. So imagine this pen as a symbol of bronchodilation, and the button on this pen is actually the beta 2 receptor. So when the beta 2 receptor is stimulated, it will produce air, which means that this air will help the patient to breathe. Next, vasoconstriction can be stimulated by alpha 1 receptor. So imagine this can as our blood. When alpha 1 receptor is stimulated, vasoconstriction will occur and it have high resistance towards the blood to flow in these blood vessels. So what is the function of vasoconstriction in this patient? So basically, vasoconstriction will help to increase blood pressure and also reduce blood loss during the injury. And lastly, epinephrine have its own adverse effect. So it will impact our central nervous system and cause depression, anxiety and also fear.
Thank you, Dr. Safa, for the crystal clear explanation.
Our distinguished guest will now explain the action of epinephrine in the human body in layman's terms. Please welcome.
Thank you, Ms. Amani. So here we have Ms. Ifa, an expert in the drug industry. She will help us to dive deeper into how the chemicals interact with biological systems in our body. Assalamualaikum, Ms. Ifa. Waalaikumsalam. Thank you for your time today. So how actually the pharmacodynamics and the mechanism of action of epinephrine in our body? So first I'm going to explain about the pharmacodynamics. Actually, epinephrine is the sympathomimetics drugs, and it will cause the adrenergic receptive mechanism on the cells, and it will mimic the sympathetic nervous system for the facial arteries and cilia. And the most significant function of epinephrine is to increase heart rate and myocardial contractility. And also, breathing will release via beta receptors. And the two effects will produce bronchodilation, which is useful as an adjunct treatment of asthma, vasodilation, epilepsy, and increased atmospheric production. So next, we move to the mechanism of action of epinephrine. Epinephrine acts on alpha and beta adrenergic receptors, and it is the strongest alpha receptor activator. Epinephrine also relaxes the smooth muscle of bronchi and iris, and it is useful to treat the manifestation of allergic reactions and associated conditions.
And this drug also produces an increase in blood sugar and increase in glycogenesis. Meanwhile, through its action on glutaminase receptors, epinephrine leads to the bronchial smooth muscle relaxation and helps to relieve bronchospasm, wheezing, dyspnea, and that may occur during anaphylaxis.
Oh, thank you for the clarifications, Ms. Ifa. So now I would like to pass back to Ms. Amani.
That was an incredible explanation, Dr. Safa and Ms. Ifa. Thank you so much for agreeing to appear on our show today. After hearing the explanations, having a severe allergy may be distressing, but by keeping epinephrine on hand and ready to use if necessary, you can change the fate of your life and the life of other victims. And with the help of our guest today, I hope the general public will gain a better understanding of the importance of epinephrine in our lives. Well, that concludes our daily news for today. I would like to thank all viewers for tuning in today. Thank you.